Welcome and welcome back to the channel. So in this particular video, we'll be starting with the next nucleic acid inhibitors. Here we have quinolones and fluoroquinolones. Okay, so let's get started. What was quinolones? Okay, so we have quinolones. The first quinolone was nalidixic acid. Okay, so this nalidixic acid was used as a urinary antiseptic against E. coli, protease, Klebsiella, Enterobacter, Salmonella and Shigella, but not Pseudomonas. So then for activity against Pseudomonas, fluorinated quinolones. Okay, the fluorinated forms of quinolones were introduced. They have an activity against Pseudomonas. So we have the fluorinated form. These are the fluorinated analogues of nalidixic acid. These are bactericidal drugs. We'll see how they are bactericidal drugs. And these fluoroquinolones involves, we have first generation and second generation. The drugs are norfloxacin, ciprofloxacin, ofloxacin, pfloxacin. In second generation, we have levofloxacin, moxifloxacin, gemifloxacin, lomfloxacin, sparfloxacin. Now we'll be looking at towards the mechanism of action of fluoroquinolones. So we'll see these are basically effective against the gram-negative and the gram-positive organisms. Okay, we have against the gram-positive and gram-negative organism. Let's see what is their mechanism of action in gram-negative organisms. So these fluoroquinolones, they inhibit the DNA gyrase. So basically they act upon two enzymes. In gram-negative, they act upon topoisomerase second, which is also called DNA gyrase. And what is the function of DNA gyrase is, after the helicase enzyme has unwinded the DNA, so the topoisomerase second or gyrase, what is its function is, it has to remove the positive superhelical twist. Okay, it has to remove the superhelical twist that arises after helicase has unwinded the DNA. And in gram-positive organism, it acts upon the enzyme topoisomerase 4th. What is the action of topoisomerase 4th? That is separation of daughter DNA strands after replication. So if fluoroquinolones are acting or inhibiting the topoisomerase 4, so the action of separation of daughter DNA strands after replication will be inhibited. Okay, so in this way there is no nucleic acid synthesis. So these are nucleic acid synthesis inhibitors, and if there is no nucleic acid synthesis, no nucleic acid synthesis, so we have they act as bactericidal drugs. Okay, these are bactericidal drugs. Now let's see what are the therapeutic uses of fluoroquinolones. So firstly, these are used in urinary tract infections and are effective against various gram-negative bacillus, like we have E. coli, we have Enterobacter. All right. Secondly, we have it is also used against the GIT infections, like we have diarrhea. Okay, so diarrhea due to E. coli, we have Shigella and Salmonella. Thirdly, we have these are helpful in treating STDs, like we have gonococcal infections. Fourthly, we have skin, soft tissue and bone infections. These are also treated using fluoroquinolones, and this it is effective against what? We have Staphylococcus aureus and many other gram-negative bacillus. It is also used in respiratory infections. Also we have, it is also a point to note here is, it is also active against Mycobacterium tuberculosis. All right, it is also active against Mycobacterium tuberculosis. Now we have, for example, in respiratory infections, we are talking about these two drugs. We have levofloxacin and moxifloxacin. These are two drugs that are highly effective against community acquired pneumonia and chronic bronchitis. Okay, so this is an important point. Now we'll be looking at the adverse effect of fluoroquinolones. So okay, now we'll be looking at their side effects. Adverse effects are what? The side effects. This may not be visible. I'll take another color. Okay, so now we have GIT side effects are what? We have nausea and vomiting. Then we have certain CNS side effects like headache, dizziness and insomnia. Okay, there are certain hypersensitivity reactions seen as a side effect of fluoroquinolone. So we have, these are skin rashes and photosensitivity and skin rashes are seen. Now we have certain contraindications to fluoroquinolones. That means in what situations, in what conditions fluoroquinolones are contraindicated or they are not administered. So we have pregnancy, And secondly, we have in younger children. So basically what happens in younger children is it inhibits the process of chondrogenesis. We can write here fluoroquinolones inhibits the process of chondrogenesis. So we'll see what cartilage damage is C. Now we'll be looking at certain advantages of fluoroquinolones, how they, what are the advantages that they carry. That is, they have broad spectrum antibiotic. These are broad spectrum antibiotics. They are effective against gram-positive, gram-negative organism, various gram-positive, gram-negative organisms, and also they have good oral bioavailability. All right, so they have good oral bioavailability. Let us revise it again from the starting. So we have quinolones and fluoroquinolones. These are nucleic acid inhibitors. The first quinolone was nalidixic acid. It was a urinary antiseptic against E. coli, Protease, Klebsiella, Enterobacter, Salmonella and Shigella, but not Pseudomonas. So for that, the fluorinated forms or the fluorinated analog of nalidixic acid was introduced. It has an activity against Pseudomonas. Okay, so these are fluoroquinolones. The fluoroquinolones, the name of the drugs or we have examples are norfloxacin, ciprofloxacin, ofloxacin, pfloxacin, levofloxacin, moxifloxacin, gemifloxacin, lomfloxacin and sparfloxacin. What is their mechanism of action? Here we see that fluoroquinolones have basically actions on two enzymes. So in gram-negative organism, they act upon bacterial DNA gyrase, that is topoisomerase II. What is the normal function of DNA gyrase is? It removes the superhelical twist that arises after helicase, unwinds the DNA. So basically, if this is inhibited, so fluoroquinolones inhibits the removal of positive superhelical twist that arises after helicase, unwinds the DNA. Okay, there is no release of tension. Then we have gram-positive organisms. We have FQs, that is, these inhibit the topoisomerase 4th enzyme. So there is inhibition of separation of the daughter DNA strands after replication. We'll be seeing about the therapeutic uses. So we have in UTIs, in GIT infections like diarrhea, we have in treating STDs, skin, soft tissue, bone infections and respiratory infections. What are the side effects? In GIT, we have nausea, vomiting. In CNS, we have headache, dizziness, insomnia, hypersensitivity reactions like skin rashes and photosensitivity. There are certain contraindications we have like pregnancy and in younger children because it inhibits the process of chondrogenesis. There are also certain advantages like we have good oral bioavailability and these are broad spectrum antibiotics. That's all. Thank you so much.